So my name's Steve Wilding. I work with Bayridge Counseling Centres out of Ontario, Canada. We're a practice comprised of roughly 60 plus therapists, always growing. We have a few locations scattered throughout Southern Ontario and a few in Alberta, and ever looking to expand. We offer a wide variety of services, including psychoeducation assessments, regular psychotherapy, social work, psychological assessments. And we also partner with a child psychiatrist to offer psychological assessments for children under the age of 10. Prior to using Yung, we were using the standard EHR for all of our documentation. We had some templates laid in, but it did very often require therapists to open and begin typing all the individual notes. And accessing these was actually kind of frustrating and difficult across the board. Out of my own selfishness, I wanted an easier solution to this. And with the rising kind of AI tools available out there, I started my own personal process in investigating for my own use. I presented this to our admin and clinical board just to ensure that I wasn't crossing any bounds and was able to use this within my own practice, which automatically spiked their interest, and they asked me to do some deeper research. So through this process, I tested a whole bunch of various AI note-taking apps, and at the end of that, we settled after a long process with Yung Sidekick. So in my time testing a wide variety of AI tools, I found that a lot of the note-taking apps were designed to be pretty generic for health industries across the board. They gave decent notes, but they seemed really sporadic, not really consistent. Once I stumbled across Yung Sidekick, I realized very quickly that it was targeted to exactly what we wanted it to be. It gave us consistency, it gave us clarity, it gave us control, and more than anything else, it also gave us continual extra tools to use. The cross-session AI in particular really stood out as it allowed us to build an ever-growing kind of client narrative story, prep for next sessions, and some neat little additional tools for our day-to-day use. Prior to full clinical adoption, I was a sole tester for roughly 3 months, reporting my findings to our admin and clinical board. After that process, we brought on a few extra therapists to continue that trial and gather some results. Once we were happy with all of our findings and we went ahead with Yung Sidekick as our full clinical rollout, we started to introduce this bit by bit to our various therapists. We held a large town hall meeting with everybody in our practice, introduced it, showed it off, and allowed for any questions and concerns. After that process, we rolled out in groups of about 10 to 15 at a time, individually training each of them so that they felt confident and answered any personal and direct questions. And by the end of it, we got everybody up to speed and using Yung Sidekick as often as they can. In the first few months of using this, I personally noted a pretty big drop-off in mental load and stress, which was very helpful. It was much easier to sit and be present with my clients without having to worry about every little detail that I'd have to write down. We have quite a few therapists with different focuses, some with some pretty heavy administrative workloads. And in those early months, they had a lot of questions about whether or not Yung would suit their purposes. So we worked directly with Yung to develop quite a few internal tools that helped alleviate a lot of that, including the WSIB rollout, which was very, very well received by our WSIB therapists. They across the board noted dramatic decreases in some of the administrative workload that was on their plates. So across using Yung Sidekick, we've definitely noticed an increase in free therapist time. As a personal example, I can now run an 8-hour day, including all of my notes and billing, in about 15 to 20 minutes at the end of my day. Previously, this would easily take an hour or more. For our WSIB therapists in particular, we're definitely noticing a reduction in about 4 to 5 hours of paperwork on a weekly basis. Adoption rate across the clinic has been substantially high. There are legitimate questions which we can easily answer and have answered along with the help of Yung directly to make people feel comfortable and confident in using the tool. So in the rollout, there was a pretty big split on people being very excited and willing for the up-and-coming change. And there were people who might have been skeptical, mainly around concerns of privacy, confidentiality, and whether or not this would actually be a helpful tool. For those individuals in particular, we took the time to sit down and work through and discuss some of their concerns. The aspects of confidentiality on all of that was a fairly easy answer. In terms of whether or not this would be a helpful tool, it was really nice to frame it as something that isn't just there to take notes, although that was a big consideration. Consistency across the board has been a very, very helpful aspect. But also trying to view Yung Sidekick not just as our AI note taker, but also as something that we can bounce our own clinical judgment off of. And so very often we would share with them, hey, here's a tool where you can sit down, you can get a note outputted, and even if you don't actually use it as your final note, or you edit it, or even if you disagree with it, that is just as helpful as it giving you an absolutely perfect note. It's challenging our clinical judgment, keeping us on our toes, and allowing us to review information from a session that we might have otherwise missed. Once we talked about this with those different clinicians, they became much more open to the idea of using it, and many have started to use it as their daily tools. So for day-to-day usage, it definitely starts with some of the additional tools that Yung Sidekick offers. Prep Highlights has easily become one of my personal favorite tools that exist within Yung, allowing me to walk into a session and quickly recap past sessions that we've had, just to kind of refresh myself and offer some insights into where I want to go with that session. This has been much easier to use than trying to open our EHR and browse through a bunch of past notes to figure out exactly where we're at. Once we actually go through, we either record our sessions or use Dictate Recap, and at the end of the day, it's simply a matter of reviewing, editing, copying and pasting into our EHR, and being done. Now, there also are a whole bunch of additional tools that have become very helpful. So client profiles and stories have been great for making internal referrals or even external referrals. The unofficial diagnostic metrics, they have been great to give a visual oversight of how things are going. Substance use, all of these other tools on a day-to-day have been incredibly easy to access and very helpful to make sure that we walk into every session prepped and ready to go. For any clinics considering rolling out Yung Sidekick and any other AI tools, one of the things that we had to approach and confront was whether or not we want to. AI is here and it is being used across multiple practices, whether that be mental health, physical health, physicians' offices, anything else. As therapists, as clinical directors, we also do need to be aware of the changes in technology. And so for us to really thrive in our jobs and to connect with our clinicians to use the tools that are out there, we need to be well versed and experienced in these tools. Now, Yung Sidekick has more than proven its ability to follow our HIPAA and HIPAA requirements, safety concerns, confidentiality. The tools, the AI note-taking itself has been consistent, smooth, and very polished. The additional tools have been something that have been way more helpful than I would have expected them to be, and I can't imagine my days without them. They don't replace what I do at all. They are not a therapist replacement, but they absolutely allow me to do the most important thing as a therapist, and that's to sit down and be present and connect with my clients. I know with any type of change, especially technological change in psychotherapy, resistance can be high. But at the end of the day, I highly encourage that if there is interest, that if there is even questions and ways to try to make your day-to-day better, do investigate, do ask, do try. Because the worst case is you don't use it. The best case is you've made your day-to-day that much easier.